Hello, and welcome to the Disability Awareness Training. My name is Denise Luzak, and this PowerPoint training was developed in coordination with the New York State Office of the Chief Disability Officer, Kim Hill Ridley. The agenda items that are going to be gone over today. First, I have disability awareness and introduction. I'm going to show a short disability sensitivity training video. We're going to go over disabilities, the ADA, the Americans with Disability Act, person-centered language, developmental disabilities, mental health disabilities, blind and legal blind, low vision, deaf, hard of hearing, deaf blind, aging, medical equipment etiquette, service animals, job accommodations. And then lastly, I'm going to give you the list of resources that were used to develop this PowerPoint, as well as resources for contacts. Okay, the objectives for today. After this presentation, participants will be able to demonstrate appropriate etiquette and communication practices. Participants will be able to recognize barriers individuals with disabilities face in employment and community settings. Disability awareness. This is the process of educating people about disabilities and the challenges individuals with disabilities may face in everyday situations. The goal is to promote understanding, respect, and the use of best practices that help prevent discrimination. Disability awareness also emphasizes recognizing and respecting people with diverse abilities and needs, and creating environments where everyone can participate fully and equally. It's also important to focus on the individual, not the disability, and to recognize each person's strengths, preferences, and abilities. And always ask someone if they need assistance before stepping in, rather than just assuming help is needed. And above all, treat everyone the way you would want to be treated. And that's with dignity, respect, and patience. Next, we have ableism. Ableism is discrimination against people with disabilities, and this can be done intentionally or unintentionally. Under the Americans with Disability Act, discrimination includes actions or policies that limit equal access, participation, or opportunity for people with disabilities. Ableism is often based on the belief that there is just one normal or correct way for bodies and minds to function. And when workplaces, programs, or services are designed only for that assumed norm, people with disabilities may be excluded even if exclusion was not the intent. The ADA, Americans with Disability Act, moves the focus from fixing individuals to placing responsibility on organizations and society to remove barriers to provide reasonable accommodations. And then also attending disability awareness training such as this one can really help to identify ableism in everyday language, assumptions, and practices so people can create spaces that are legally compliant, respectful, as well as inclusive. Okay, next we're going to move on to the short disability sensitivity training video. Some disability awareness videos may seem funny or exaggerated, and we might think to ourselves, who would ever act like that? The truth is, these are important reminders. They help us reflect on our own behaviors, challenges, assumptions, as well as stay mindful of how our actions and attitudes can impact others. Okay, so I'm just going to stop sharing this screen so I can pull up the video.
Good morning, Bob.
Morning there, big man. Morning, Alice!
There's no need to be awkward.
Poor Bob. Like so many of us, he just doesn't know how to interact with people with disabilities.
It's pretty easy, really. People with disabilities are people first.
We need the same things that every person needs, like respect.
Good morning, everyone.
Attention!
Okay. Maybe we need to be more specific.
The easiest way to show respect is to focus on the person, not the disability. It's okay. You'll get the hang of it.
One easy way to focus on the person is to watch the person signing and not their interpreter.
Or their companion.
It's really cool that you'd like to help, but do us both a favor and please ask me first. What you think might be helping?
I got you.
Wait, Oh no, might actually not.
If you'd like to offer me help, let me hold on to your elbow. Don't take mine.
Hey, would you like to take my arm?
Sure.
Assistive devices help us to live our lives. They're really important and really personal.
Grabbing them only makes it weird for everyone.
What?
Please only touch our devices and service animals if we've given you permission. And don't take it personally if I ask you not to. Remember that my service animal helps me all the time. Neither of us would like it if we were separated.
Remember, we make our own decisions. We sign documents, vote, volunteer, work, and pay taxes.
We get married.
So don't address me just because I have a great smile.
Just because I'm blind
May I help you?
does not mean I'm deaf.
I don't know. I think he said he was gonna come, but... Just because I'm deaf doesn't mean I'm blind.
And just because I use a wheelchair doesn't mean that I can't sweep you off your feet.
So take a deep breath. Relax. We don't bite.
Unless we're really hungry.
Hello there, ladies. How are you?
Hello. And if you're not sure what to do, just ask.
Hi, would you still like to see a menu?
No thanks, but can you please read it to me?
Sure, definitely.
Just treat us the way you would want to be treated, and we'll all be okay.
Morning.
Good morning.
Morning, Alice.
Right.
Awkward no more. Nice job, Bob. Go forth and be human.
There's no need to be awkward.
Okay. Let's move on to disabilities. Understanding disabilities. Disabilities can be permanent, temporary, or fluctuate over time. Recognizing this helps create inclusive environments. There are several categories of disabilities. We have sensory disabilities that affect sight, hearing, or other senses. For example, anosmia. This is the loss of the sense of smell. There's cognitive and developmental disabilities that include autism and learning disabilities that can impact learning, processing, as well as understanding information. And then there's physical and neurological disabilities and these may affect mobility, coordination, as well as an individual's overall physical health. Next, we have mental, emotional, and behavioral disabilities. And these include conditions that impact mood, behavior, or mental processing. And then we have communication disabilities, and these can affect speech or language that can influence how a person interacts with others. And it's always important to remember that many people experience multiple types of disabilities at the same time. The disability categories that I'm going to go over. There's invisible disability, which is the inability to tell that a disability actually exists. Examples of these may include mental health conditions. These conditions could be PTSD, anxiety, depression. As well, learning or cognitive disabilities fall under the invisible disability category. Examples such as ADHD, dyslexia, also chronic pain such as fibromyalgia and arthritis fall under invisible disabilities. And then certain neurological disorders such as epilepsy. And then we have the category visible disability. This is the ability to tell that a disability exists. Examples of some visible disabilities may include wheelchair or mobility device users, also prosthetic limbs or braces, and then certain conditions such as cerebral palsy or muscular dystrophy. Okay, next I'm going to move on to two important advocacy groups. The first one is the Americans with Disability Act, and this protects people with disabilities from discrimination in many areas of life. The ADA website offers a wide range of information and guidance. Topics on the ADA website include service animals, accessibility parking, the use of mobility devices. Also, the ADA website provides helpful resources and detailed information on ADA laws and regulations that support compliance, as well as promoting accessibility for everyone. On the ADA website, you could also find free guidance on a variety of topics, and also ones that clarify responsibility and best practices. The second group we have is the Protection and Advocacy for Beneficiaries of Social Security, or BAPSS. This supports people with disability who receive SSDI or SSI and want to work. This program helps remove employment barriers by providing advocacy, education, and rights protection. It also assists with accommodations, discrimination issues, and understanding how work affects benefits. Okay, next moving on to person-centered language. Respect is the foundation of disability inclusion. Every person deserves to be treated with dignity, regardless of whether a disability is visible or invisible. A good guideline is treat others the way you would want to be treated. This includes how we speak, listen, and offer help. And most importantly, focus on the individual, not the disability. A disability does not define a person's abilities, personality, or value. And by seeing the person first, we create a more welcoming and inclusive environment. Person-centered language, this means acknowledging someone as a person before anything else. A diagnosis or disability is just one aspect of who they are, and it does not define them. This approach reinforces respect and supports dignity and inclusion. Here we have some examples of appropriate person-centered language. For example, we don't want to refer to someone as a diabetic. Instead, we refer to that individual as a person who has diabetes. And then another example, disabled person. We don't want to say this. Instead, we want to use an appropriate person-centered language, such as a person with a disability. And here's another example of a person with a mental health condition, which is appropriate to say. Not appropriate would be referring to that individual as a schizophrenic. And then you can also see the other appropriate person-centered language, such as a person with, or a person who uses a wheelchair, a person with an intellectual disability, a person with a speech disability. These are all appropriate to person-centered language examples. Some general guidance. People with disabilities have their own preferences and needs. And everybody experiences disabilities differently. People with the same disability may have very different preferences in regards to communication, styles, or support needs. And showing respect means avoiding assumptions and not deciding what someone's needs are based on appearance or any past experiences you may have. And if you think someone may need assistance, ask first rather than stepping in. A simple question like, would you like help with that? This allows the person to accept, decline, or explain what would be most helpful. If assistance is needed, work together to identify the best way to provide it. And what works for one person may not work for another. And then some common expressions like everyday phrases that you may use, such as see you later or I'll keep an eye on it. Those are not offensive and do not need to be avoided. People with disability use these expressions themselves. And overcorrecting language can feel awkward or uncomfortable. So it's best to focus on just being natural, respectful, and inclusive rather than overly cautious with your language. Okay, moving on to developmental disabilities. These refer to a broad range of conditions that can involve mental, physical, or both. These conditions may affect areas such as self care, learning, communication, mobility, and the ability to live independently. And the impact can vary widely from person to person, as well as strengths and abilities differ just as much as support needs. Developmental disabilities are typically lifelong and begin in childhood. While individuals certainly may gain skills, independence, and coping strategies, over time they may continue to experience challenges that affect their daily functioning. However, with appropriate supports, accommodations, and inclusive environments, people with developmental disabilities can and do lead meaningful, productive lives. It's important to speak directly to the individual and address them, not a companion or support person that may be with them. And then to reduce any distractions, if the environment is noisy or busy, consider moving to a quieter or more private space to help that individual focus and communicate better. Also, communicate clearly and patiently by using clear, short sentences. And also be willing to repeat information or or questions as needed. It's also important to be flexible in communicating by being open to different communications methods to ensure instructions are clear. And if it's appropriate, offer help with written materials, such as completing any documents or forms, or even understanding written instructions. And also, it may be helpful to allow extra time for decision making or adjusting to changes in the routine, as this will help reduce stress and any confusion. It's also important to respect autonomy when offering help. Always wait for the individual to accept assistance and avoid over assisting or acting in a way that may feel patronizing. Practice patience and flexibility. Take time to understand the individual's needs and communication style. Importantly, to check in to make sure your message is understood and they can understand. Okay, next section, moving on to mental health disabilities. And mental health disabilities cover a range of conditions that significantly affect a person's intellectual, cognitive, emotional, or behavioral functioning. These can impact daily life, work, relationships, and independence. Some common terminology you may hear mental health disabilities referred to as you may hear mental illness, and this is a general term for conditions affecting one's mental health. You may also hear serious mental illness, SMI, and this refers to a more severe condition that significantly is interfering with daily life activities. You may also hear mental health disorder. This is more of a clinical term, so it's often used in medical or policy terminology. Mental health disabilities can often cause significant distress that affects work, relationships, or daily activities. And a typical response to stress or loss, such as grief after a loved one dies, is not considered a mental health disability. And not all socially unusual or uncharacteristic behaviors are mental health disabilities. Some examples, someone's political or religious beliefs, those are not disabilities. A mental health disability exists only when a condition causes dysfunction that is significantly impacting daily life activities or life functioning. Some different categories and types of mental health disabilities. There's anxiety and mood disorders, substance use disorders, psychotic disorders, as well as traumatic brain injury. Okay, this concludes the mental health disabilities section. Next, we're going to move on to blind versus legal blindness. Blindness isn't always complete blindness. Many individuals can perceive light or shapes. The term blindness refers to a range of vision loss, and that loss can be from very limited sight to no vision at all. And blind also refers to vision loss that cannot be fully corrected with glasses or surgery. Legal blindness is considered when your vision is 20/200 or less in the better eye with glasses or contact lenses. And then we have visual acuity, and this is the sharpness of vision measured by the ability to see letters or numbers at a set distance. And then we have normal vision, and that is considered 20/20. Many people with vision loss develop a heightened awareness of sound and touch, and this is to navigate their environment. So there's many supports available for people with vision loss. Supports include assistive technology devices such as large print, screen readers, and Zoom text. And these all help with reading, communication, and accessing digital information. Other support, mobility aids such as white canes or service animals. These help provide independence and safe navigation throughout the community. When communicating with people who are blind, it is important to speak normally and don't assume a blind person can hear. Ask if they would like information read out loud if and when needed. Some examples of when they might need information read out loud are to hear what menus have, reading newspapers or any documents, or maybe receipts. Anything that can't be accessed in an alternative format. When guiding a person who is blind, always ask before guiding, physically or verbally. Never grab or touch without permission. Offer your arm for support and wait for them to take it. Describe the route and any upcoming changes in direction. And when guiding an individual to a destination, give a verbal map of the route so the person knows what to expect. And when you arrive at your destination, identify any key objects so they can orient themselves safely. And at this time, it is okay to guide their hand gently to a chair, railing, or desk for extra support. Interacting with someone who is blind, always let that person know you are there to avoid startling them. Introductions help the person understand who is present. Again, maintain normal tone. There's no need to raise your voice. Give cues about the room, entry and exit, as this is going to help navigate and anticipate any changes. Guide dogs and group communication. Guide dogs are working animals, so avoid petting or distracting the dog. Always use names in conversation, as this is going to help a person follow who is speaking. And then also some communication tips for people with vision loss. Let the person know when you are about to move. This is going to help avoid any surprises. Clearly indicate when a conversation is concluding. And people with vision loss or who are blind, they rely on communication through spoken language, screen readers, braille, or tablets. or texting. Okay, now we're going to move on to low vision. Low vision is a condition caused by eye disease. It means a person's vision is 20/70 or worse in the better eye, and it cannot be corrected with regular glasses. And then we have visual acuity. This is how clear or sharp your vision is. It's measured by how well you can see letters or numbers from a certain distance. And then normal visual acuity is 20/20 vision. Guiding someone with low vision. Offer your arm if you are walking together and let that person take your arm. Usually they'll take it at the elbow. Explain where you're going so they're ready for any turns or changes in direction. And when interacting with someone with low vision, always let that person know you are there to avoid surprise or confusion. And identify yourself. Introductions help them understand who is present. Maintain a normal tone and speak normally facing that person. And announce when entering and exiting a room. Again, guide dogs are working animals, and interacting with them can distract from their job. So make sure to walk on the opposite side of the dog. Use names in group conversation as it helps the person follow and participate. Some other communication tips for people with low vision. Announce before moving or even ending a conversation. And their low vision preferred communication methods are spoken language, screen readers, braille, tablets, or texting. Okay, now I'm going to move on to hearing loss. And the hearing loss section also consists of hard of hearing as well as deaf. So, understanding hearing loss. Hearing loss means a person cannot hear as well as someone with normal hearing. It can be mild, moderate, severe, or even profound. And it may affect one or both ears. So, it can make it hard to hear conversations or even loud sounds. Hard of hearing refers to people with mild to severe hearing loss. And usually, people that are hard of hearing communicate through spoken language and may benefit from hearing aids, cochlear implants, assistive devices, or captioning. Being deaf usually means minimal or no auditory perception. Not all deaf individuals identify with the deaf culture or community. And it is important to distinguish between audiological deafness and cultural identity. It's also important to ask about preferred communication methods, such as sign language, lip reading, or assistive devices, or maybe a combination of several. Hard of hearing. Individuals that are hard of hearing may identify as having hearing loss rather than being part of the deaf community. They may prefer person first language, which is why it's important to always ask what they prefer. They also often rely on visual communication and need information in accessible formats. Hard of hearing means that a person does not hear as well as someone with normal hearing. Normal hearing is defined as hearing thresholds of 20 decibels or better in both ears. Hearing loss can impact how a person receives and processes sound in everyday situations. Hearing loss exists on a spectrum and can be classified as mild, moderate, severe, or profound. And the degree of hearing loss influences what sound a person can hear and how loud sounds must be, as well as whether assistive devices or accommodations may be helpful. Hearing loss can also affect one or both ears, and depending on the type and the degree of hearing loss, individuals may have difficulty hearing conversational speech or loud sounds such as fire alarms or any emergency announcements. People who have are hard of hearing typically rely on spoken language rather than sign language. Um, so it is always best practice, again, to ask and respect a person's preferred communication method. Many individuals who are hard of hearing use assistive technology to improve any sound in speech, such as hearing aids that will amplify sounds. Also used are cochlear implants, and these implants help by bypassing damaged parts of the ear to directly stimulate the auditory nerve. Sound amplification systems such as induction loops or FM systems may be used to help reduce background noise and improve sound clarity. These are found to be helpful if used in group settings, classrooms, or even public spaces. Captioning. This is also an assistive tool that is used. Captioning provides visual access to spoken content. Captioning is helpful during meetings, trainings, videos, and virtual events. Captioning also not only benefits people who are hard of hearing, but really to anyone in noisy environments or people who process information visually. Many people who are hard of hearing prefer to communicate using spoken and or written English. Communication preferences can vary widely, so it's important to not make any assumptions and to ask the individual what works best for them. Some individuals who are hard of hearing may use American Sign Language, while others do not. This is a personal choice, and it may depend on many factors. Captioning plays a critical role in access to information. Closed captioning is commonly used for videos, meetings, and virtual platforms, while CART, which stands for Communication Access Real-Time Translation, provides live word-for-word transcription during meetings, trainings, or any events. And the impact of unaddressed hearing loss. So when hearing loss is not addressed, it can affect an individual's life in many areas, including communication and speech. Because of this, individuals may miss information, misunderstand conversations, or experience an increased effort and fatigue when trying to listen. Cognition. It may contribute to difficulty with memory, attention, and information processing. A person's life may be affected by socially withdrawing from group activities or social gatherings or even conversations in general. Also, if unaddressed, loneliness and stigma may arise, and this may lead to negative assumptions. Individuals may feel self-conscious about even asking for accommodations. As well, education and employment can be affected if hearing loss is unaddressed, because without supports, individuals may face barriers to learning, participation advancement, and full exclusion. So, when communicating with someone who is hard of hearing, make sure you have the person's attention. There are several appropriate ways to do this, such as gently tapping on the person's arm, maybe waving your hand in their vision line, lightly stopping on the floor to create vibration. Or if you're in a large group setting, just briefly flicker the lights. And then again, always use respectful and non-startling methods. And also, when communicating with someone who is hard of hearing, look directly at them and keep your face visible. Speak clearly and naturally instead of exaggerating your speech or shouting. And by communicating in a steady, moderate pace, it helps with understanding speech and lip reading, both of which many individuals who are hard of hearing rely on. Having good lighting and reduced background noise and clear sight lines, those will also help to further improve communication and should be used whenever possible. Some tips for communicating in noisy settings in a group. If in a group, speak one at a time. If the environment is noisy, use written communication when helpful. Maybe use mobile apps that provide captions for phone calls. There are caption landlines such as CapTel, and these display real time call captions. Supportive and communication. Even if a person uses hearing aids, they still may ask you to speak slowly and clearly and need the background noise reduced. As well, they may ask you to repeat or rephrase information. Okay, next we're going to move on to the section on deaf. And I'm going to talk about deaf identity and language preferences. Many deaf individuals identify as a cultural and linguistic minority and have strong positive identity. Some deaf individuals may prefer identity first language, such as a deaf person. Always ask and respect individual preferences. American Sign Language, ASL, is the preferred mode of communication for many deaf individuals. And ASL is a fully developed language with its own grammar and syntax. Other sign languages in the US include Black American Sign Language, BASL, and then there's Plains Indian Sign Language, PISL. ASL is a visual language, and communication relies on the eyes, facial expressions, and body movements. Then we have lip reading, or called speech reading. And this is a communication method used by some deaf and hard of hearing individuals. And it's used especially in familiar settings, such as restaurants. This involves interpreting lip, facial, and tongue movements to understand spoken language without hearing. Captioning. This is an essential accessibility tool for people who are deaf or hard of hearing because captioning provides a visual representation of the audio content, making spoken dialogue, narration, and environmental sounds all accessible. When communicating with a deaf person, maintain direct eye contact and address them, not the interpreter. The interpreter's role is to be there to facilitate communication, but the focus should remain on the deaf individual. Before starting communication, it's important to get the person's attention. This can be done by using gentle, respectful methods, such as lightly tapping their arm, waving your hand, or using vibration cues like tapping the table or lightly stomping on the floor to make vibration. And in a large group setting, it may be helpful to briefly flicker the light.
Just send it to you. I have something to sign. Okay, I'll take care of that. Right away.
Some effective communication tools to use with deaf individuals.
So just want to let you know.
Face the person directly and clearly speak naturally and at your own normal pace. Position yourself under or next to good lighting and keep your hands away from your mouth while speaking. Offer to exchange written messages if it's helpful for communication. These practices all demonstrate respect and consideration, which helps create a more inclusive environment for all individuals. Written communication and ASL users. Do not assume a person who uses ASL can communicate easily with written documents. ASL is communicated very differently from spoken languages. Some individuals may use notes, apps, or tablets to facilitate communication. Again, the best practice is to ask the individual what communication method works best and then be flexible. Scheduling appointments with deaf individuals. Always ask if a sign language interpreter is needed. And if so, arrange that interpreter well in advance of the appointment date. Okay, moving on to deaf blind. Deaf blindness is when both vision and hearing are significantly impaired and neither sense can fully compensate for the other. So in this case, communication and access to information requires specialized strategies. To help compensate, tactile senses such as touch, vibration, and physical cues are important for communication, orientation, as well as environmental awareness. And it is important to use the term deaf blind rather than deaf and blind. Terminology does matter. Some deafblind individuals identify culturally and may prefer to use identity first language over person first language. Always respect the individual's language and identity preferences. Next, we have Usher syndrome. This is a genetic condition that affects both auditory and visual systems. Hearing loss can range from mild to complete, and vision loss progresses over time, often starting with difficulty seeing in low light or maybe experiencing night vision issues. And with Usher syndrome, the retinas of the eyes are slowly damaged over time. And then retinas, they do have a crucial role in detecting light and enabling vision. Okay, next syndrome we have is Charge syndrome. Charge syndrome is a rare genetic disorder that presents differently in each individual. And no two children are affected the same way, which really makes personalized medical care and support essential. Babies who are born with charge syndrome often are born with life-threatening birth defects. These life-threatening birth defects are seen to affect the heart, nerves, vision, hearing, genitals, nasal passages. Okay, we have the preferred communication methods for deaf-blind individuals. Communication methods preferred are American Sign Language, ASL, visual communication, tactile is signing into the hand, protactile, signing on the body, braille, and then also assistive technology. These devices may be screen readers, Zoom text, or refreshable braille devices. Again, always ask the individual which method or methods work best for them, as preferences do widely vary. Deaf blindness presents unique challenges, and because both vision and hearing are impaired, this dual sensory loss can impact nearly every aspect of daily life, such as an individual's social life, communication, access to information, orientation, and the ability to move around freely and safely. Understanding these impacts is essential for providing inclusive support. Okay, next section is aging and disability. So, as people age, it is common to experience changes in hearing, vision, mobility, and overall health. These changes are a natural part of life and should be recognized without any stigma. Many individuals will benefit from accommodations or assistive devices, such as maybe hearing aids, canes, walkers, or even wheelchairs. These supports allow people to fully participate and maintain their independence. And using the word disability openly and normalizing it, it really promotes inclusion and helps to reduce stigma. It also encourages a culture where differences are acknowledged and accommodated rather than treated as abnormal. Aging with a disability. This refers to individuals living with the long term effects of disabilities that they acquired early in life and are now aging. At this time, unique healthcare needs arise as they are aging. Um, and they must manage cumulative effects of their long term disability along with the age related changes. Some examples are memory, vision, hearing, and mobility. And then we have chronic conditions, maybe diabetes, hypertension. But the New York State Department of Health and the New York State Office for Aging are coordinating efforts for the New York State Master Plan for Aging. This Master Plan for Aging aims to ensure that older adults and people of all ages can live healthy, fulfilling lives, age with dignity and independence. The New York State Master Plan for Aging reflects on a person-centered approach. And this is because it emphasizes dignity, choice, and quality of life for all individuals as they age. Okay, next we are going to move on to medical etiquette, medical equipment etiquette. So before helping, do not take charge without consent. Position yourself at the same eye level as a person using a wheelchair, and never touch a person without consent, except for handshakes. Do not grab assistive devices such as someone's white cane, wheelchair, or walkers. And then speak directly to the individual, not just the caregiver that may be with them. Next, we have service animals. Service animals are trained to perform specific tasks that support their owner's disability. They may guide individuals with vision loss, alert to sounds, or provide mobility assistance. Interacting with a service animal without permission can interfere with its work and potentially put the owner at risk. So always ask the owner before approaching the animal. If they say no, respect their decision and don't take it personally. And then also by using the term service animal rather than service dog, this is promoting inclusiveness of all animals trained to assist with disabilities. While dogs are the most common, other animals like miniature horses are actually legally recognized as service animals. Some do's and don'ts of service animal etiquette. So do not offer treats or toys, as this can interfere with training and work. And be respectful. Don't ask the owner about its disability. Avoid distracting the service animal with any noise, eye contact, or treats. And if the animal is assisting the owner, or if assisting the owner, hold the service dog's leash, never the harness. Just some other additional things that service animals do. They help reduce anxiety. They can alert an individual when it's time to take medications or even when symptoms are about to occur. They can also notify an individual when someone approaches them from behind. They provide emotional support, many things. Okay, next we have job accommodations. Job accommodations are about removing barriers so employees with disabilities can work effectively. Examples of this may include facilities, installing ramps, accessible restrooms, or automatic doors. Also, we have job restructuring, maybe reassigning non-essential tasks or modifying how work is performed. Work schedules, allowing flexible hours such as part-time options, maybe telecommuting. Maybe equipment modification, such as providing screen readers or adapted tools. Maybe policies or materials, such as adjusting training materials, performance evaluations, or even testing methods to ensure accessibility. Okay, now these are the resources I said at the beginning I'm going to provide. Again, these are the resources that were used to develop this PowerPoint, as well as contact references and resources for your use. I have the Office of the Chief Disability Officer, Kim Hill, the Division of Human Rights, U.S. Department of Justice, New York Education Department, Access VR. I have the New York Commission for the Blind, as well as the New York State Office of Mental Health. I have here on also OPWDD, the Office for People with Developmental Disabilities, the Americans with Disability Act, ADA, ada.gov. I've included the Job Accommodation Network, askjan.org, as well as there's a guide to interacting with people who have disabilities. The U.S. Commission for Civil Rights, a resource for person-centered language, and then lastly, Interagency Coordinating Council on services to persons who are deaf, deafblind, and hard of hearing. This is my contact information. Should you have any questions or need support, you have my office phone as well as my email. Thank you for taking the time to watch this training. I hope you found this information helpful and relevant to your work. And if you need to revisit any section, please feel free to pause or rewatch as needed. Thank you again.